Hello everyone, today's video is on peptic ulcer disease by Dr. Anonymous MD. This video is for educational purposes only. Please listen to a health professional for any medical advice. What is peptic ulcer disease? Peptic ulcer disease is a condition where there are ulcers in the stomach and or duodenum. This disease is associated with H. pylori infection and the use of NSAIDs. An ulcer forms when the stomach's mucosal lining breaks down. It can be indicative of gastric cancer. So if you see on the picture, you can see the ulcer is here where the arrow is pointing to, and you can see the blood vessel in the ulcer. You can also see the scope here, and this you can see the scope because it is in the retroflex position, meaning that it's in the candy cane position, and you can see and you're seeing back into the direction of the esophagus. So just to review a basic review of this part of the GI tract. So you can see the esophagus is right over here, the lower esophagus. Then here's the stomach, here's the pylorus, and then here's the duodenum. So if you see on your right, this gastric ulcer is right around here, and you can see that it's a very deep ulcer because the surrounding tissue is very inflamed. And on your left here, you can see that this ulcer has been cauterized. And here where the arrow is pointing to, this is the pylorus. So you're looking down into the direction of, or you're looking down into the pylorus here. Symptoms of peptic ulcer disease include epigastric pain, bloating and belching, heartburn, nausea and vomiting, and bleeding and melena. What causes peptic ulcer disease? Helicobacter pylori, or H. pylori shortened, causes peptic ulcer disease. It is one of the most common causes. The bacteria cause the mucus coating of the stomach to break down, allowing stomach acid, hydrochloric acid, to irritate the sensitive stomach lining beneath. About 10% of people diagnosed with H. pylori develop ulcers. H. pylori is also a carcinogen that causes gastric cancer. So if you see this diagram on your right, this is a diagram of the H. pylori bacterium, and you can see that it's helically shaped, and it's a gram-negative microaerophilic bacteria. So H. pylori epidemiology. In the United States, about 30% of the population is infected with H. pylori at some point in their lifetime. Globally, the number is roughly 50%, and in developing countries such as South Sudan and India, it can be up to 80%. Prevalence of H. pylori is decreasing in both the US and internationally. Drugs, specifically NSAIDs, is also a very common cause of peptic ulcer disease. These drugs disrupt the permeability layer of the mucosa, making the mucosa susceptible to injury. Factors that increase risk while taking NSAIDs are steroid use, such as prednisone, H. pylori infection, family history, older age, being female, and long-term NSAID use. Severe physiologic stress also, although not as common, causes peptic ulcer disease. This includes burns, central nervous system trauma, ventilator use, and surgery. Serious illnesses may also cause secondary ulceration. Ulcers caused by stress are increasingly seen in critically ill children. Additionally, genetics play a role in peptic ulcer disease incidence. More than 20% of patients with peptic ulcer disease have a family history of ulcers. Complications of peptic ulcer disease. So hemorrhage is a complication, and if a vessel in the ulcer ruptures, blood may slowly leak into the digestive tract, eventually leading to anemia, or a deeper, larger ulcer may also lead to sudden and more serious bleeding, as you see on your right. An indication of significant bleeding is black tarry stool and or bloody vomit. So if you see on your right, this is an endoscopic image of a bleeding ulcer. So you can see here that uh, this is a arterial bleed because there's a lot of blood spilling out, and this will lead to black tarry stool. And maybe if there is so much blood, then there's no time for the stool to become black, and you might just excrete red stool. Another complication of peptic ulcer disease is perforation. The ulcer perforates or makes a hole through the wall of the stomach or duodenum. As a result, food and bacteria may spill into the peritoneal cavity or the abdominal cavity, causing infection and inflammation. So if you see the picture on your right, here is a perforation through the wall of the duodenal bulb. So you can see here, and then so food and bacteria will spill through this hole here, and this may lead to peritonitis, which you can see on your left here. So what happens is the peritoneum or a lining here will get infected due to the bacteria spilling out, and the whole abdominal cavity will become inflamed. Another complication of peptic ulcer disease is gastric outlet obstruction. So due to the inflammation around an ulcer, passage of food can be hindered. Food can accumulate, and endoscopic balloon dilation or surgery may be needed. This usually occurs at the pyloric sphincter. So you can see here where this is the pyloric sphincter here. You can see that gastric outlet obstruction, you can see that this causes obstruction. So what will happen is that the food that comes down here, it'll be so it won't be able to pass down into the small intestine, and it'll build up here. Epidemiology of peptic ulcer disease. In the United States, peptic ulcer disease affects 4.6 million people annually, with roughly 10% of the population having a duodenal ulcer at one point in their lifetime. The incidence of duodenal ulcers has decreased over the last several decades. Globally, frequency of peptic ulcer disease is associated with prevalence of H. pylori and NSAID use. Peptic ulcer disease prevention. So if you want to avoid peptic ulcer disease, you should avoid unnecessary use of NSAIDs. If needed, use a proton pump inhibitor, which I'll explain in a later slide. You can use acetaminophen rather than NSAIDs when possible, because acetaminophen is a drug that serves a similar purpose to NSAIDs, but it does it through a different mechanism. Use the lowest effective dose of an NSAID and switch to less toxic NSAIDs. You should also use COX-2 inhibitors, which are specific and less toxic than COX-1 inhibitors. And there's also a cure for H. pylori. Peptic ulcer disease detection. An EGD or upper GI endoscopy may be used. The ulcers appear as breaks in the mucosa, sometimes with visible vessels. So this image here, this is upper GI endoscopy. This is from upper GI endoscopy. And this one here is an upper GI series, which is a test in which the patient drinks a barium sulfate contrast. An X-ray indicates the presence of an ulcer. Peptic ulcer disease treatment. Endoscopy followed by appropriate therapy based on findings. Proton pump inhibitor is also used to inhibit the production of gastric acid. In addition to acid suppression, peptic ulcer disease is usually treated successfully with cure of H. pylori and or abstinence from NSAIDs. So here I just want to explain the mechanism of acid secretion in the parietal cell. So you can see here, this is water and carbon dioxide, and through this enzyme, carbonic anhydrase, it creates carbonic acid. And because carbonic acid has a low Ka, you can see that it'll partially dissociate here. So this bicarbonate anion will leave and go into the bloodstream, and because this has a negative charge here, the chloride anion will enter the parietal cell, because like charges repel. The chloride ions will continue to enter the lumen of the gastric pit. Then you see here the hydronium ion here, it'll enter the lumen of the gastric pit because of this potassium ion recycling. So this is a hydronium potassium ATPase pump. So similar to the sodium potassium pump, this potassium cation will recycle, and then this will lead to hydronium ions continuing into the lumen of the gastric pit, and this is done by active transport. As you see here, the ATP becomes ADP and an inorganic phosphate. So a PPI, or proton pump inhibitor, will inhibit this transport protein right here. So this leads to lower acid secretion here. So then this can help peptic ulcer disease. So a summary of this presentation. So peptic ulcer disease is a condition where there are acid-related ulcers in the stomach and/or duodenum. It's caused by H. pylori, NSAID use, and physiologic stress. Symptoms include epigastric pain, nausea, vomiting, and black stool. It is detected by endoscopy or upper GI series. It is treated with a proton pump inhibitor, avoidance of NSAIDs, and/or a H. pylori cure. This is my bibliography. Thank you for watching. If you have any questions, please leave them in the comment section below.